Hi, Miss Anderson. I'm Carrie. I'm one of several people that are going to come and talk to you today about your diabetes and to give you a little bit more information about hypoglycemia. So to start off, I want to discuss a little bit about the signs and symptoms that you need to be looking out for. So when your blood sugar gets low, you may start to feel anxious or hungry. You may also feel palpitations, numbness around your lips. You may start to feel shaky, irritable, or you may start sweating. As your blood sugar drops even lower, you may have difficulty thinking, you may get dizzy, you may experience fatigue, sleepiness, your speech may get slurred, you may feel weak, and you may even lose lack of coordination. And if you continue to go with untreated hypoglycemia, you could develop seizures or go into a coma. So as you know, normal blood glucose, according to the CDC, before a meal is 80 to 130 milligrams per deciliter, and 2 hours from the start of a meal, you want it to be less than 180. According to the CDC, anything under 70 milligrams per deciliter is hypoglycemic. So if you check your blood glucose and it turns out to be under 70, what I want you to do is eat 15 to 20 grams of a carbohydrate, preferably fast acting. That can be glucose tablets, regular soda, sugary candy, or honey. And then in 15 minutes, I want you to recheck your blood sugar. If it's still below 70, I want you to eat something else and check it again. And I want you to continue doing that until it's above 70. Once it's above 70, I want you to eat a regular meal. That way it'll keep your blood glucose up, your levels up. Some major complications that you can encounter with hypoglycemia. The main one is hypoglycemia unawareness. And this is after you've been a diabetic for a while, you start to notice less and less when you become hypoglycemic. This is important because you can go into a coma, like I stated earlier. Anderson, so Carolyn is going to come in and talk to you next, okay? Thank you very much for your time.
Hi, I'm Carolyn. I'm going to be your nurse today. We're just going to talk about what we might do as nurses to help you with your hypoglycemia and what we want for the outcomes to be as we're managing that hypoglycemia. I'm also going to talk about a little bit of education for you for prevention of the hypoglycemia. So first off, we're going to check your blood glucose levels before each meal and at bedtime, just so we know whether or not we need to give you some glucose, which would be another thing that we'll do. We'll give you glucose. We're going to try to get you a pure glucose. If we can't give you that, then we're going to give you fast absorbing carbohydrates to help get that sugar up. And then once we get that sugar up, it's going to be evidenced by that tight glycemic control, which is what we want to happen. So that's going to be our desired outcome. And then we're also going to educate you on the signs of hypoglycemia and make sure that you are administering your insulin properly at home and everything like that, and you know which factors can alter your insulin requirements. So that's going to be your intake of carbohydrates, your intake of really anything by mouth. It's also going to include your activity and stress levels, along with whether or not you have an infection. Those can all alter how much insulin you need. And then we're also going to go back over blood glucose monitoring via finger sticks, just so we're making sure that you're doing that in a timely manner when you need to and everything like that. All right.
Hey, Miss Anderson, I'm Kathy. I'm going to be your nurse for today. Today I'm coming in to just educate you on some medications that you're currently on or that you've been prescribed. It says here that you're taking digoxin, which increases the cardiac output and slows your heart rate down. What you need to know about this medication is that before you take it, you need to check your pulse and make sure that it's not less than 60. If it is less than 60, that can show, that's actually one of the first things that shows digoxin toxicity. So you would need to notify your provider if you're at home and that happens. We're going to be evaluating your serum electrolytes especially your potassium, magnesium, and calcium. And we'll do that periodically through your therapy. It says here you're also on Coumadin, and this is just to prevent any pulmonary embolisms. So with this, we're just going to assess your signs for bleeding, hemorrhage, and that can be bleeding gums, runny nose, if you have tarry black stools. And then also with this medication, you need to avoid foods high in vitamin K. So that's a lot of your green leafy vegetables, because vitamin K is actually the antidote for warfarin, so therefore it would not work properly. You're on glucotrol for your type 2 diabetes, and that lowers the blood sugar in diabetic patients. So you're going to need to observe yourself for signs of hypoglycemic reactions, which would be sweating, hunger, weakness, dizziness, tremors, fast heart rate, and anxiety. And then also, if you're on a beta blocker, sometimes that can make your signs for hypoglycemia very subtle, so you would not notice those signs. You're on captopril for high blood pressure or hypertension, so that's going to lower your blood pressure. That's going to improve your survival and reduce your symptoms if you have heart failure. With this, we're going to frequently assess your blood pressure and pulse, and we're also going to monitor your bone and electrolytes, especially your serum potassium levels, your urine protein levels, and we're going to monitor you for adverse reactions. One reaction that you may experience is a persistent dry cough, and that usually does not go away until you have discontinued that medication. You're also on a D5W, which is glucose, and that's through the IV. And this is just for hypoglycemia. It's provision of calories, and we want to try to prevent you from going into that hypoglycemia. So while you're on this, we're going to assess your hydration, and we're going to monitor your serum glucose, potassium, and phosphate. Lastly, you're on dextrose 50, which is going to be an IV push, which just means we would add that if you needed it. And that's also to treat hypoglycemia, or if you're in like an insulin shock. So when we're putting this in, we're going to do it slowly because it's hypertonic. And we want to avoid you going into hyperglycemia. So we're going to administer it slowly into a large vein to prevent phlebitis and sclerosis of the vein. So we're going to watch your IV site frequently and make sure that it's not infiltrated and you don't have any pain or swelling. So that's all your medications, and I have somebody else from the team that's going to come in and assess the rest of the information.
Infectious illnesses causes a stress response in the body by increasing the amount of cortisol and adrenaline. These hormones work against the action of insulin, and as a result, the body's production of glucose increases, which results in high blood sugar levels. When your sugar is high, the white blood cells in the body are unable to eliminate bacteria because they cannot move at their normal speed and do not reach the infection site quickly enough to engulf and kill the bacteria, causing hypoglycemia to persist, and ketoacidosis can occur. Ketoacidosis is a condition in which the body breaks down fat for energy rather than using sugar. The condition is more common in type 1 diabetics because they don't have the insulin supply to deal with the elevation and begin to break down fats for fuel. When fats are broken down for fuel, they release a chemical called ketones. The kidneys normally excrete ketones through the urine, but when the blood glucose gets too high, the kidneys are unable to remove the buildup of ketones. This is a warning sign that your diabetes is out of control or that you are getting sick.
Hello, Miss Anderson. I'm Ozo Konkwo. I'm part of the team taking care of you, and I'm here today to talk to you about how I'm gonna help you manage your hypoglycemic occurrences. For me to help you assist in managing this, first of all, I have to tell you what is hypoglycemic occurrence. This always happens when your blood sugar is below 70. And when this happens, what are the signs and symptoms that you will see for you to know that you are in hypoglycemic event? The symptoms that you will see is being shaky, you're going to be confused, you're going to be anxious, you're going to be nervous, you have dizziness and hunger. When this happens, know that you are in a hypoglycemia occurrence is happening with you. The next thing that you will do when this happens is for you to always make sure that you carry 4 tablets of glucose tablets or juice, but it has to be 4 ounces. While you're doing this, in order for you to care for yourself, remember the 15-15 rule, which means that every time that you go into a hypoglycemia occurrence or hypoglycemic event, you need to consume 15 grams of carbohydrates to rise your blood sugar, then wait after 15 minutes and recheck it. So when you feel all the symptoms, what you need to do is to put the 4 tablets of glucose, if you have it, into your mouth, or drink 4 ounces of orange juice. Wait 15 minutes and recheck your blood sugar. You will continue doing this until your blood sugar is at least above 70. Then you will stop and eat your normal food. Now, what brings about hypoglycemic event? What are the things that you will do for you to go into hypoglycemia? The things that you need to do is when you're missing a meal, when you're taking too much insulin, when you're taking all the diabetic medication, or when you're drinking alcohol, when you're not watching what you eat, when you're eating less, too much exercise. Be conscious of what you eat to make sure that you are on track. So when you don't do this, that's when you feel the symptoms of a hypoglycemia event, and that's when you will start the 15-15 rule, which is raise up your blood sugar with 15 grams of sugar, wait 15 minutes, and recheck it until it is at least above 70. Now, the thing I'm going to teach you is to always make sure that you will carry this glucose supply with you all the time, so that whenever you have an event, so you can take care of yourself. Then also what I need to tell you is to have your medical ID alert. So when you have it on Uzumi, you have a hypoglycemic occurrence and you are unconscious, so that when the rapid response team come around you, they will know that you have a diabetes and they will know the next thing to do. Assuming that you are also now with me in the hospital, for me to help manage if you go into hypoglycemic event, I'll still use the 15-15 rule with you. Then I will keep checking your blood sugar until it's above 70. Then if you are unconscious, that's when I'm going to give you like the dextrose 5%, or give you the glucagon as prescribed by the doctor. And I must tell you that I've come to the end of educating you what I have to do to help you when you go into the hypoglycemic event, and I'll leave. Another person will come and teach you some other things to help you manage your diabetes situation.
Hey, Ms. Anderson, Cortez student nurse here. I'm going to go over the importance of top 3 priorities of how to manage your diabetes and what to teach you on. Main thing is with having diabetes is being compliant and having the ability to monitor your blood sugar daily. It's very important. And also knowing the signs and symptoms as stated by my previous peers, and knowing how to look for signs and symptoms of hypoglycemia and hyperglycemia. One of the very first priorities that I'm really concerned about for you is eating a balanced diet. Understanding what type of foods to eat, such as carbohydrates, fruits, vegetables, just to name a few that'll kind of help you. You want to eat kind of non-starchy fruits and vegetables, such as broccoli, cucumbers, lettuce, tomatoes. And as far as fruit, you want to do strawberries, blueberries, bananas. Fruits and vegetables kind of in that regimen that kind of help combat with a balanced diet. And as far as meat, we want to do baked fish, baked chicken. So in foods that consist in that kind of category, you want to eat to manage your diabetes. Also, when we're trying to comply and be a good patient as far as monitoring diabetes, we also want to educate you on the importance of how to use a needle and syringe. Because sometimes it can be very stressful and difficult not knowing how to use a needle and syringe. So we want to stress the importance and show you how to use a needle and syringe to administer your insulin. So we want to make sure that you know where you're giving it, how to give it, when to give it, and also understand that sometimes you may have additional medications to give it with your insulin, and to know the adverse effects and side effects of the medication. So we'll have you to do a return demonstration, so that way you fully feel confident that you're able to administer insulin with no problems. And lastly, we know that sometimes this can be very stressful, finding out that you are a diabetic and not knowing how to manage it and all the loops that goes with it. So we're here to support you as a team to make sure that you have all the support that you need. But if need to be, we can also align for you to go to mental services that kind of help you cope with the symptoms that you are having when managing your diabetes. We just want the best for you. So If you have any questions about anything from my previous peers or anybody, feel free to contact us or let us know. As a group, I want to thank you for allowing us to take care of you, and thank you for being a great patient.